Hey, this is Russ. People have asked me in the past, what is your favorite flexion exercise? And I've answered this before, but I know that we have new people all the time, and sometimes they don't get to see the old videos. So let me answer it again. Now, the first thing I will tell you is I am not a doctor. I'm not a physical therapist. I have no medical training at all. If you follow me, you take your lives in your own hands, all right? But this is what I do, and I do suggest that you check with your doctor and physical therapist before you do anything, okay? But having said that, let me show you how I do it, all right? My number one favorite exercise to do on my own would be going on the stairs, yeah. Now, I'm not talking about going up and down the stairs. I'm talking about using the stairs to do an exercise. So what I will do is I will hold on to the handrail and banister, whatever's easy to grab, okay? I'll hold on to that with my left and right hands, and then I will put my leg on the second step, okay? And if you're new to this, first step, all right? And then I will lean forward and try to go as deep as I can. Now, I will tell you that the first step is about as far as I was able to go when I started out. But eventually you do get to the second step, and I'm currently, as of this video, 17 and a half months since my knee replacement, so I should be on the second step, right? Now you may ask, can you do this on the third step? Well, that's a long reach, right? If you have 3 steps you can do it on, it's kind of a long reach. I wouldn't recommend it. I think second step is fine, all right? But you do want to definitely hold on to something. You want stability before you do this. You don't want to lean in without some stability and something to kind of pull yourself out of that. Because if you lean in and you can't get out of it, that's going to be bad for you. All right. So hold on to something when you do this. Now, the other thing I used to do is squats. Yeah, and everyone knows what a squat is, right? You just squat both the left and right legs down, just kind of like sitting squats, that type of thing. I'm not going to show you how to do that because I think everyone knows what a squat is. And again, holding on to something helps a lot. I wouldn't try to do a squat without holding on to something. So make sure you have something that's nearby that you can grab onto, okay? That's actually the favorite things that I like doing. Now, I do also have a jazz unit, as you know, joint active systems. That helps push me as well, and I do that, well, right now I'm doing it once per day, but really, if you get a jazz unit from the start, you should be doing it 3 times a day, 30-minute sessions, up to 30 minutes, I should say, with that thing turned in so you have a pain level of maybe 2 or 3 out of a 10 scale, and you should do that 3 times a day. Now, I'm quite a bit in at this point. I'm only doing once per day, and I'm probably doing about 20 minutes, 25 minutes, something like that. I'm trying to wean myself off of it at this point, trying my best to keep my 120 degrees of flexion without having to use it at all. And then eventually when that happens, I will return the unit back to jazz, all right? But I am able to get 120 fairly easily at this point. At one point, I had reverted back to about 104. And with the jazz unit, I was able to bring it back to 120, all right? At physical therapy, they got me to 130, right? I hit that like 3 times, I believe. And then the pandemic happened and I stopped physical therapy. And then after I stopped, I wasn't doing a whole lot to help myself, and I had reverted backward to that 104. But getting the unit back in my hands, I was able to bring it back to 120. So I do that, and I also do these leg lunges on the stairs. So that is what I do. If you want to try that, give that a try. Start out with the first step, go to the second step if you can. I would not recommend the third step. It is kind of a long stretch to get there, and we're not really as stable at that point to do it. So don't do that, all right? Anyways, if this has been helpful for you, hit the like button, hit the subscribe button, and I'll talk to you guys next time.